Right now, I'm a clinical psychologist by training, and I do research in the nature and scope and treatment of pain in persons with disabilities, physical disabilities of all ages, people with spinal cord injury, multiple sclerosis, amputation. And my interest is, given that these populations have such a high incidence of pain, I want to better understand how we can teach them to manage the pain better so that they can live full and rich lives. So I'm interested in studying treatments, assessment, all that. Right now, two main topics are assessment, what's the best way to assess pain in these populations, and in terms of treatments, I'm studying hypnosis and self-hypnosis training as a method for teaching people to manage the pain and its effect on their lives. And it's very, very, very interesting. We're getting very interesting results. Now I think the main challenge is that we understand that many treatments that we provide are effective, but they seem to be effective for subgroups of people. So I think we want to better understand how we could combine them so that more people get more benefits and understand how they work. Because there may be one or two key mechanisms that all of them are effective due to, so that if we find that, then we can focus on those mechanisms rather than on the treatments per se. And the whole goal being to get more people to get more relief. Well, I think the old statement, more research is needed. But I think research should focus now on mechanisms, and that if we do that for the next 5 or 10 years, we'll be in a better position to design more effective treatments. I think teaching specific skills and communicating, you can learn to be in control of this. You can learn to be in control of your life. The goal is not to eliminate pain and suffering, because we never can eliminate pain and suffering completely forever. But you can learn strategies for minimizing the impact of pain on your life and get your life on track and meet your life goals. So communicating that idea in many different ways is, and caring, of course, is important, but also teaching skills that we know work. I think educating children and the parents about the mechanisms of pain, that it's complex, and it depends in a large part on the beliefs that the family has about the pain, the coping strategies that the family uses to help manage the pain, and it's not just, is there something wrong in the body, but how the mind reacts to that, and teaching the family those so that the parents can support the children in learning new skills. And not to blame the child, but to encourage the child.